folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Let's go to it, Brad. We're going to show some low back stretches. You're going to start with number one. You're going to put your feet up on a footstool or ottoman or a ball.
Or even a chair, anything.
Right.
I'm going to just demonstrate on
Are
here.
you too close?
If that was an ottoman, can you see that? Okay, but that's not what I'm going to use. But that's an option. I do like the ball better if you have one. Otherwise, use your chair or stool.
Take you single tennis ball, or you can use doubles.
Right. So it's just a sock. Just put them in there, and they stay still. They're nice.
Just a great way to mobilize or massage the back all the way, different segments.
Right. So, and I'm putting it so the balls are not on the spine. They're on each side of the spine.
Right.
Which would be right in the middle of the back, obviously. And there. And with the ball here, the advantage of the ball that you don't get with an ottoman or the chair, unless you get wheels on your chairs or ottoman, you can kind of roll and get different areas a little easier, or do this and stretch the low back muscles while you have those balls putting pressure.
Brad, is that fairly intense or not?
It's moderate. You know, it's
Okay.
going to depend on the balls and the size of the person's body and the shape of your body. So
We have found too, if you put some slits in the ball,
yes,
they're not as rigid.
right. They're
Yeah.
much softer.
Yeah.
You just have to be careful. We should do a video on how to
Yeah,
prepare
you
tennis
gotta be
balls.
very careful because you can cut your finger. Okay,
Yep.
next one. We don't like you doing a foam roller on the low back on the floor. If you're going to use a foam roller, we want you to go against the wall so you don't put full weight on it. And you can just work your way that way. It's a great way for working in fascia. I like a foam roller that has knobs on it. This one doesn't.
Yeah, the bumpies.
The bumpies, and because it really works the fascia and it works the muscles too. But
Yeah.
this works fine.
Yeah,
As a
yeah.
start.
I would just, if you have one of those, don't think you have to go get one right away. Just use that and see how it goes.
Yeah, Brad, do you want to show how to do a stretch of the quadratus lumborum, which is
yes.
a back muscle,
All
one of the
right.
side back muscles?
Can I go to the floor?
Sure.
So do the cross-legged seated position like this, and then you're going to take this hand up like you're reaching up in the sky for the apple, and then up and over, and you'll get more than just the quadratus lumborum. And I like to grab right here,
That works good for me.
and it just seems like it gives you a better stretch. And we're going to go over and do both sides, and you'll feel sometimes if I rotate a little bit and go this direction, it seems like it isolates a little more to those muscles in the low back and where that key well is.
What-
But
When I really like to stretch those muscles when one is tighter than the other.
sure,
I don't like the imbalance.
Right.
That could cause you to get pulled over. So I like to actually grab onto a stair rail.
sure.
And then I grab, like you say.
So you do it standing.
Yeah, standing. And I grab, and I do like you say, I grab my head
Yep.
like this, and I pull over like this. Works really great.
So how many? So we're just going to do pressure on, pressure
Yeah.
off, or if you want to hold it for,
If it's really tight, you may want to stick on it longer.
yep, 10, 15 seconds. I know some studies talk about 30 seconds.
Yep.
I usually don't hold mine that long.
Can I take the...
Oh, you want to have?
Bench?
Oh,
Yeah.
I'm off.
So I'm going to go ahead and use the foam roller here. That's something you could probably do on the floor normally. And what you would do is, this is a Brian Mulligan technique. Legs are fairly far apart, not just shoulder width, a little bit more than that. And I put the arms up on here and roll forward like this. Oh,
Oh, Bob! What the? This is a family show, for God's sakes.
really stretches the fascia, I think.
And now this one I don't do because it bothers one of my shoulders because you're really extending. But if your shoulders are healthy, this is a good maintenance stretch for your shoulders as well.
Shoulders and even mid back and low back.
Yep.
So next one, cat camel. This is a great one. Dr. Stuart McGill likes this one. He is the world's foremost expert on back pain, and he likes you to do this one because it gets mobility in the back without putting a lot of stress on it.
Look at that. And then make sure you breathe well with all of these exercises.
Good point,
Relaxed
Brad. Good
breathing.
point. And I'm not sure which one I am, a cat or a camel, but
Yeah, one way or another.
can
The
decide.
back is arching and it rounds up, rounds down. Kitty cat, camel,
all
cow,
right.
horse, whatever.
All right. Especially if you're having a disc problem, you're going to want to do some prone lying, or feels good. If you're a person that has pain when you bend forward, it's good to just lie down on your stomach for a while.
Right.
You might also try putting fists underneath your chin like this,
So that's just arching the back
Yeah.
up slightly.
or even more, you get up on prone props where you're on your elbows.
And I just want to say that typically these are like Dr. McGill talks about, you're going to hold this for statically, for 15 to 30 seconds, as long as it's not creating pain.
Right. Pain is going to be your guide on this one. And then you can do micro press ups where you just go press up slightly. Now, if you are younger, you might try working your way all the way up.
Yeah, so if you're 20, 30, even in your 40s possibly. But, and then we're probably going to do 10 repetitions of these as
Right.
typically a maximum.
All right. Last one. We're going to go ahead and do some rotations here.
Sure.
This is one that almost anybody could do to start.
Right, yeah.
We're just doing windshield wipers, as Brad likes to call them. You put your knees together and you go back and forth.
Feet are together as well.
Right. Now you could try feet closer to you or farther away.
Right.
And then eventually, if you're really good or it feels good, you can actually bring the one leg up and grab onto it like this, stretch over like this.
Note that this shoulder stays on the bed or the floor,
Right.
whatever you're on, and that rotates and put a nice twist in that lower
Again,
spine.
let pain be your guide because you should not have pain. It should not increase your pain. It should not upset you.
It should feel like a good stretch.
Right. That's it, Brad. That's all the low back stretches we have.
Excellent job, Bob.
Give them a
Thank you.
try. Only use the ones that you feel are helpful. You're a busy person. Don't spend time on the ones that don't.
Right. You may only pick 2 of them out that really
Right. That
feel
you do
good and
daily.
they wake you up and they make you ready to roll.
All right. Thanks.